See you, Dr. Jen Ashton joining us now with answers to your latest questions about this outbreak. And we'll get started with the first one, Jen. If the coronavirus keeps mutating, does it become weaker?
This is such an interesting question because we know that the class of family that the coronavirus comes from is prone to mutation. We call it highly mutagenic. But there is a lot of controversy and myth about whether or not just a virus mutating necessarily makes it worse. In some cases, as this question asked, maybe it could make it weaker as it adapts to its new host, which are human beings. So right now, we don't know the answer to this, and there are reports out of China that because they sequence the genetic fingerprint of this virus early on, as we test around the world, we are comparing it to that initial fingerprint. And there is evidence that there are about 30 strains of this coronavirus now. So yes, it is slowly mutating. There's some suggestion that in some cases it's making it stronger, but that is not conclusive at this point. So time will tell.
And that would also explain why, if you have antibodies, it doesn't necessarily mean you're immune if there is that many strains going on. All right. Yep. Next question. Has there been any research on the relationship between COVID-19 cases and the amount of time people spend outdoors in different states and countries?
No, but this is what is going to be so important as we go into warmer months, not just as a country, but in different parts of the world. Because remember, when we're in our summer, the southern hemisphere is in their winter. It would make sense that as people are outdoors more, they're not touching those hot spots that people who are confined indoors, and so maybe that's reducing the rate of transmission. But again, how this virus will respond to changes in humidity, sunlight, people's behavior being outdoors, we'll have to see.
All right. Next question. Are there any notable similarities researchers are finding with asymptomatic COVID-19 patients?
They don't know. So this is what's really interesting. There have been reports from the CDC that 25% of people known to be positive with COVID-19 show no symptoms. Then Iceland saw it at 50%. Now a recently published study done in people in enclosed populations, in this case jails or prisons, found over 80% of positive cases occurred in people with no symptoms. So yes, we need to study that population to learn, is there something different about the host? Or are they showing some atypical symptoms? We don't know. But remember, asymptomatic infection is thought to be massively important with COVID-19.
Okay. All right. Next question. You've talked about ACE receptors and how COVID-19 attaches to them. Does this have any effect on patients taking ACE inhibitors?
Right. So to go back to some molecular biology, if you will, those ACE2 receptors, that is what this virus uses to attach to and then infect our cells. People who are on ACE inhibitors who block that, there was a thinking, is that actually making them more susceptible? Because again, by association, we were seeing people with high blood pressure who are often on this class of medication faring worse. I want to be crystal clear now. In the cardiovascular literature and in clinical practice, there is zero evidence at this time to recommend that people change existing medication that they're on. That could expose them to more risk than any potential benefit. And right now, there is no evidence that being on that class of medication increases someone's risk.
So that's very important to know, to stay with what your doctor has told you to do.
Absolutely.
All right, Dr. Jen Ashton, thank you. And you can submit your questions to Dr. Jen on her Instagram at Dr. J. Ashton.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.